My mom passed away on February 24th, and then her sister died April 2nd. It's very hard to see someone that you love and care for go through such a tragic disease. It affects the entire family.
12 years after losing her mom to lung cancer and her aunt to breast cancer, Cynthia Booth overcame her own apprehensions and scheduled her first mammogram.
My name's Denise.
The possibility of learning that you could have breast cancer can be a little, make you a little nervous.
So what we're going to do is take 2 pictures of each breast, one at a time, for a total of 4 pictures. We'll take 1 of each from the top and 1 of each from the side. We do compress each time.
I wanted to come forth specifically during Breast Cancer Awareness Month to let people know that you have to be proactive and that it's okay, and I wanted people to walk with me as I made my first journey to my first mammogram.
Okay, we're going to do that other side.
Many women are concerned about having mammograms. They're anxious that something abnormal will be found, and women who've had a family member who's had breast cancer or another form of cancer may have had a pretty traumatic experience observing that in their family member. So that can make them even more anxious.
Dr. Jennifer Van Vickel is one of the radiologists at the Rex Breast Care Center who reads the digital mammograms like Cynthia is having.
Women should discuss their family history with their doctors to find out what's best for them.
Don't move. And you can relax.
We want to be able to detect breast cancer early when it's treatable. And by having the screening exams yearly, we have an opportunity to detect it on a regular basis before it's become more advanced.
Dr. Van Vickel urges women not to wait a year if they notice something suspicious.
If women palpate a lump or they have breast pain that's unusual for them, or develop a nipple discharge or skin changes or changes in their nipple, they should consult with their doctor to find out whether they should have what's called a diagnostic mammogram.
There's a little uncertainty, not knowing what to expect, hearing stories about how it feels.
How you doing? Good.
It's usually not severely painful, it's just mild pain, and it's only for a couple of seconds while the compression on the mammogram machine's on. A lot of women are relieved, yes. Once they've had their mammogram and found out that their mammogram results are normal, then they don't have to think about it for another year, and it really puts them at ease.